Mic test 1 2 3. Mic test 1 2 3. Mic test 1 2 3. Mic test 1 2 3 4 5.
mic her up. Do this one.
Do a pile.
Yeah, I'll show you. I'll alternate on. Yeah, just put that right there.
Thank you.
No problem.
Hey, how are you?
Thank you. Just lay this one here. All mics.
You're gonna be there as well. She's coming, we promise. So, busy times. Yeah, I feel like I should just like, wanna move in? Yeah, I was gonna move in with you guys today. Sounds good, come on, we got plenty of room. Let's just set up a little like, between joint information center or something. Can't tell you how many rooms I was in. She has a list about this long. That's all right. Bring it. No, there's a lot. And that's one of the good things about it. Community preparedness is so important.
Got a little line of them. One by one.
And she's so good at it too.
Oh, she's got one's got up.
Okay.
I think probably all of them do. It's easier to clip them.
Hello, everybody.
Welcome back.
Thanks.
Well, I mean, never
Did
left.
you guys, right, I didn't leave. Did you guys watch me go, no.
Yeah, that one has a little.
Okay, can go this way.
Mhm.
Okay. Dun, dun. Sorry, guys. Well, shoot. What did I do? It's stuck somewhere. There we go. It was stuck on my jacket.
That one looks like it's on its last leg.
It does. I don't know who's this sad person who's that. Oh, shoot, come on. Hang on, guys. Sorry, I apologize. This really shouldn't be this hard.
Do you want me to do it?
No, it's just, it's weird. It's on my pants and it's stuck up under my jacket, on my shirt, and it's too short. There we go. Am I getting electrocuted by this?
No, it's got a little short in it.
It's steam powered, so you might.
So I think I'm good.
All right, this one will go on the same side.
Okay. Kelsey, you're gonna have to help me with this.
You want me to clip it and you. That one. This one you'll have to put in a pocket, no clip.
Okay. I can't hold it because I have to talk with my hands. I'm gonna have to start coming in here earlier just to get dressed.
Assembled.
Yeah.
Okay, this one will go on the same side.
Oh, my goodness.
There we go. I'm hoping this one's an alternate side. Yep. This one's the alternate side.
Okay. I thought they were ambidextrous. I thought you could change them.
You can.
It's just, I haven't figured out how to do it. Okay.
This one.
That looks terrible. You don't think so? Well, you never know.
Yeah, that's why.
That's why.
Oops.
Last one.
Oh, yay. And so, I didn't know whose mic was whose, so there's no priority in placement at all. Anyway,
Where
I'm
do
gonna
you
stick
guys
this
want her a
one in
little
my-
back, or is she good right
where do you
there?
want me?
Right there?
That's
Okay.
fine. The one you clipped on the top is rubbing against your jacket a lot.
Is that better?
Yes, much
Okay.
better.
Okay, sorry.
Appreciate it.
Yep. Don't breathe. glasses feel crooked.
I'll just stand back here again, so you can look at me, so she's not doing tennis ball court looking. Is everyone ready? All right. I can
Sure.
test mics just by saying,
Sure.
spelling your first
Yep.
last name.
Martha Buchanan, M-A-R-T-H-A, B-U-C-H-A-N-A-N, M.D., Director of the Knox County Health Department.
Any questions? You can go ahead and ask.
Sorry. What has any patients been tested at least in Knox County for COVID-19?
We have tested patients and will continue to test patients as this event evolves. To date, we don't have any positive tests.
What's the overall status of the virus in our area?
Well, to date, we don't have any positive tests. We continue to evaluate folks who are at risk. We work with our community partners, the hospitals, providers, and test folks who screen out positive for risk factors, and even folks who maybe they added a risk factor, the Tennessee Department of Health did, of somebody who has a severe pneumonia that doesn't have another cause. We haven't had any of those, but that's another test criteria.
Do you know why the state isn't releasing county-level case reports anymore?
It's a great question for the Tennessee Department of Health.
Would you release a county-level case report?
We'll follow what we have always followed when we've had outbreaks like this, because we have outbreaks like this, have had outbreaks like this in the past. We generally announce our first case so the public is aware there's a case in the county. And then after that, we just do case counts and regular updates.
How many test kits do you guys have here in Knox County?
So a little bit about testing. So in order to test, you have to collect the specimen and then you send it to the lab for testing. So we're not actually doing any testing. We don't actually have test kits. We have specimen collection supplies. And we have some of those. We've been able to work with folks that have access to those so that we can test the folks that screen out positive to need to be tested. That's a number that changes, so don't want to give you an exact number because it's changing, and we're continuously looking for more supply so that we can continue to be able to offer testing.
And how
We
many,
haven't had to turn anybody away. We haven't had a limitation based on the number of tests the state can do or the number of testing supplies that we have.
how many specimens can you collect at maximum capacity each day?
It just depends. It's very fluid. So sometimes the provider can collect the specimen. Sometimes we can collect the specimen. Sometimes the hospital collects the specimen. So that's a lot of different people collecting specimens. So it just depends on how complicated it is and how long, sometimes it's even how long the patient takes to get here. Where are they located physically? So it's a moving target because hospitals, doctors, and us are collecting specimens to send to the state lab.
Dr. Buchanan, what would you say is the biggest misconception out there or misinformation, and what do you want to tell the public about this right now to kind of calm some fears?
Well, what I think is really important for folks to remember is to put this in perspective. We have some community transmission happening in West Tennessee. We don't have any cases in Knox County right now. So therefore we don't have any community transmission happening here. People need to stay alert. They need to wash their hands, stay home if they're sick, try to avoid rubbing your eyes and nose. It's really hard to do. Avoid people who are sick, and use your judgment. If you have a chronic disease or you're older, you might want to reconsider plans, or if you're going to plan to travel. So stay up to date, but be cautious. Be cautious, but there's no reason to be panicked or no reason to be scared at this point. We continue to have more flu in Knox County than we do COVID-19 and other respiratory illnesses. Those are not the only two respiratory illnesses that circulate this time of year. So I think people need to take a breath and step back, read the guidance, and make informed decisions.
Darden Restaurants just announced that they were giving all their employees sick time as a benefit permanently for the first time. How many sick days do you recommend that people in the service industry get for just in general?
Well, I think that's a decision that the industry or the individual company has to make based on their situation. And so they make that decision based on what their needs are and what they are able to do for their employees.
How long does it take for, once you get the specimen and send it to the lab to get tested, how long does it take to get that result?
That is anywhere from 24 to 48 hours, depending on how many other specimens are going to the lab, of course. All the state departments of health and even some hospitals and providers are sending specimens to the lab across the state. So it depends on how many they get in any one day, how long it's going to take to get it back.
How many specimens are you collecting per person?
You have to collect 2, one from the nose and one from the oral cavity.
Why are we making, such a big deal about this when we're not, necessarily have the same attitude towards the flu? What's the difference?
Well, the difference is that the virus that causes COVID-19 is a new virus. We as humans haven't seen it before, which means we don't have any immune memory to help protect us. So more of us will get sick than we do with the flu. Because we have some immune memory, we've seen the flu virus before, we've maybe been vaccinated against the flu before, and even though it changes a little bit, we have a little bit of protection. We don't have that with this virus, so more of us might get sick. So it's more important than ever that you stay home if you're sick and wash your hands, cover your cough, try to avoid touching your hands and face, and try to avoid sick people and getting sick yourself.
Have you had that meeting that you mentioned last week with the Tennessee Department of Corrections yet?
I don't recall a meeting with the Tennessee Department of Corrections. It might have been
With the
Sheriff's Office. Okay, thank you. They were at a meeting with a bunch of many other emergency responders and emergency providers with my staff this morning to talk about plans and make sure everybody's on the same page and everybody kind of knows what the situation is and how to get updates.
Did they mention having a soap shortage or a supply shortage?
I was not in that meeting, so I don't have that information, and it'd be a great question to ask them if they're having a problem with supplies.
Eventually, I'm assuming there will be people self-quarantined in Knox County. What plans do you guys have to kind of check in on those people and make sure they're abiding by those guidelines?
So I do want to take an opportunity to explain quarantine versus isolation. Quarantine is what we do if you potentially have been exposed to an illness and we're afraid you might get sick. You're not sick yet, but we're watching for symptoms. And isolation is if you are sick, we know you're sick, we're going to keep you in isolation so you don't make other people sick, so we ask you to stay home. So with quarantine, there are different levels of quarantine with this particular illness. But also I think it's another important point is that we quarantine and isolate people fairly regularly because we do have TB cases in Knox County, and we have to quarantine and isolate people related to those TB cases. So it's something we have experience in and we've done before. This is a little more nuanced because there are so many different categories. So some folks, based on their risk, are able to self-monitor. They're not really in quarantine. We ask them to limit their activities, pay attention to their symptoms, and let us know if they get sick. Some folks we're asking to stay home and check their temperature regularly and report to us if they're sick. Some folks we're checking in on every day to see what their temperature is and see how they're feeling. And that's all based on the risk stratification and where they fall in that risk stratification. What was their exposure? What was their specific exposure? And that's why we take very specific histories, ask a lot of questions. Sometimes people get frustrated, but we need all that information so that we can appropriately give you guidance and protect the public. It's very similar to what we do with any other outbreak that we have. We ask really specific questions because we want to be able to give the person we're talking to the best guidance to protect themselves, their families, and the public.
And what rules are there, once that period of isolation or quarantine is over?
So if you are in quarantine, you haven't gotten sick, and your quarantine period has ended, you go about your normal activities, you're not at risk of getting ill, and you might get sick from something else, but not from COVID-19.
And lots of rumors circulating around on Facebook in the last couple of weeks, I guess, of confirmed cases that were not confirmed, people posting up. What kind of information would you like to give to the public in terms of if there is a confirmed case? Like when would you let them know and at what point? Would you let them know if there was a confirmed case?
Sure. So a couple things there. One, there are a lot of rumors. You're right. Not just on every social media has a lot of rumors. So the only source of knowledge about confirmed cases is the health department, the Tennessee Department of Health and the local health department, and those providers that cared for those people as well, of course, knowing the patient knows. So any other sources of confirmed cases, you might want to look at a second time to make sure it's really accurate. So once, like I said before, when we have our first confirmed case, our plan is to announce that we have a confirmed case as soon as we can after we have that knowledge, depending on what time of day we get that information.
So you'd have the person who was suspected take that test, have that 24-hour period where you guys would get back those test results, and then be able to let people know shortly after that.
Yeah, as quickly as we can. During that time frame when we're waiting for test results to come back, we have that person self-isolate. We check in on them, depending on, again, their risk stratification. So if at some point they get tested, the specimen gets sent to the state lab, we get those results in 24 to 48 hours. And again, depending on what time of day they come back to us, is when we would send notice out to make an announcement.
Or smokers?
You mentioned last week that you were keeping in touch with folks who were in self-isolation and self-monitoring and taking their temperatures multiple times a day. Have those cases changed? Have they improved? Have they been tested? What's the status of the folks you've been monitoring?
Well, we're monitoring a few people, and to give out those specifics, I don't have those specifics. My staff is doing that and tracking all of that information. And if folks do become ill, then we are having them tested.
Would you be willing to provide those specifics?
It's not really anything we're willing to share at this point.
Are smokers at higher risk for the coronavirus?
Smokers have lung disease, and anybody with lung disease is at higher risk for complications of the coronavirus, not necessarily getting it, but for complications. So people who are older and people who have chronic illness don't necessarily get sick more often, they just get more sick. So they have more complications from the virus than folks who are otherwise healthy.
And I assume that would be true for vapors as well?
It would be true for vapors as well, yes.
And there's also a rumor online that hard liquor drinkers are less susceptible to the virus. Is there any truth to that?
I don't know any evidence that supports that. It's an interesting question. If a hard liquor drinker is otherwise healthy, they stand the same risk as anybody else. And hard liquor drinkers that aren't healthy stand a risk of having complications.
If someone has HBP or diabetes, should they be worried about, or should they cancel any soon upcoming trips that they have?
Well, so anybody with a chronic illness or fits in those high-risk categories, I believe pregnant women, people with chronic illness, and the elderly, or people over 60, I don't want to call those folks elderly, are advised to reconsider travel plans at this time. And again, I would encourage them to go and look at the CDC's guidance as well as the Department of State's guidance on where the high-risk areas are and make those decisions in concert with their physician.
There's a lot of festivals around the country that are starting to cancel. We have some here locally that haven't yet said if they're canceling. What is the health department's recommendation on that?
Well, we're using the guidance from the CDC and talking to those organizers and helping them make an informed decision about what they do or don't do with their event.
So are you is the health department in contact with some of the local organizers?
We are working on making those contacts now. After we had the first case in the state, we kind of started more intently reaching out to those folks, and we'll be continue to reach out to them through other partners as well.
There's kind of this madness of everyone rushing to the store, stocking up on hand soap, cleaning supplies. You don't need 1 million wipes. They probably last you through a month. What is the average amount that someone would actually reasonably need?
Well, I mean, that's a good question. We have a lot of guidance in our preparedness website and on the CDC and even the American Red Cross when we're thinking about preparedness and what you need. There's guidance on cleaning on the CDC's website. It kind of depends on how many people are in your house, how big is your house, what is it you're cleaning. That's going to determine how many supplies you need. Right now, I believe the recommendation is to have supplies for a couple of weeks in case you end up having to be quarantined for a couple of weeks.
Who's at most risk of suffering from a supply shortage?
That's a great question that I honestly don't have a great answer for. I think supply chains are stretched right now, especially when we talk about hand sanitizers and other things. I think we'll have to wait and see how the government and the companies can meet those needs.
In regards to hand sanitizer, or just any of those products that people are wiping off the shelves, what if you can't get certain items like soap or hand sanitizer, what do you recommend people should get? What are the other options?
The recommendations for hand cleaning are soap and hand sanitizer. You can use dish soap. You don't have to use Dial soap or hand soap. You could even use your laundry detergent to wash your hands. It's the detergent part where the soapiness comes up and the germs and the dirt get caught in that soap and washed down the drain. So it might be a little more harsh on your hands than hand soap would be, but those would clean your hands. What we don't recommend is anybody use bleach directly on their skin. Even if it's diluted, do not use bleach to clean your skin. It's just so harsh.
What about the disinfectant wipes? Could those be used on your, on your hands?
So if you're going to disinfectant wipes on your hands, I'm sorry, is that what you said?
Yes.
I'm sorry. Those are pretty harsh as well. So, I mean, it just comes down to the fact that you're going to really irritate your hands. If they're made for use on your hands, then yes, use them on your hands. If they're made for use on a tabletop, probably not really nice to your hands, so you might want to reconsider that. One thing to think about when you're thinking about disinfectant wipes, you need to look at the ingredients and make sure they have some bleach in them, because if they don't have bleach in them, they're probably not going to be as effective as if they do.
One of the state reps in the Tennessee State House had one of their staff members call around and ask different health departments for guidance on testing. They got a bunch of different answers. Is there any clarity at the state level of what kind of the uniform response should be?
Well, the guidance that we have right now from the State Department of Health is the same guidance that's gone out to providers and to health departments. And it's, people at highest risk, folks who've traveled, folks who've been in contact with somebody who's a confirmed case, and close contact. We talk about that kind of contact. It's within 6 feet for more than 10 minutes. So it's not passing somebody on the street or walking past the exam room they're in at the hospital. It's more than that. And folks who, travelers, people who've been close contacts, or, and now they put that new the third category of somebody who has an unexplained severe pneumonia would be tested. It has been, there's been some communication challenges with making sure the phone calls get to the right place, to the people who know the answer to those questions. So as you can imagine, the health departments are large organizations and phone calls come in lots of different ways. We're working really hard to communicate internally with our staff to let them know where to send those phone calls, and working hard to address those concerns about being able to get through and get answers. And I know other health departments are doing the same.
Have any hospitals reported supply shortages to you?
No, I haven't had any reports of supply shortages from the hospitals at this point.
What all do we know about COVID-19? Do we know how long you are contagious before you show symptoms, or if it's seasonal like the flu?
Well, we won't know if it's seasonal like the flu until after this all kind of dies down and see what happens with the virus itself. So we don't have that information at this point. What they're estimating right now is that you're infectious anywhere from, I'm going to say anywhere from 1 to 4 days before you become ill. And then, nope.
I thought you were getting infectious period, so
No.
not showing that up in front, so 1 to 14 days from exposure to symptoms.
Okay, sorry about that. So we don't have, I don't think we've been able to determine for sure the period in which people are infectious. But after you get exposed, your symptoms are going to appear anywhere from 1 to 14 days after exposure. So that's one of the challenges with this virus, not having a clear picture. Are you contagious before you become ill? We know you're most contagious when you have a fever and you're coughing and you feel your worst. We know that with every virus. That's how it is. You're going to shed more virus when you're more sick.
I know we talked about the use of masks a lot, but can you touch on masks and
Sure.
even gloves too?
Sure. So a mask is really helpful in a medical setting or in any setting if a person is sick and coughing. So they put the mask on, the droplets. Remember, this is a droplet infection. It's not, you don't just breathe it out. It comes out in droplets. So those droplets get caught in that mask and they don't go onto the table or onto my hands or anything else or onto the person's hands. Masks are not helpful to protect you against getting sick because, again, you're going to get that on your hands, touch your face or nose or eyes, and inoculate yourself that way, or even if somebody's close enough and they cough or sneeze, you might get some droplets in your nose or mouth that would make you sick as well. So that's not going to really, they don't do much to protect you. Gloves, this is a droplet infection. Gloves are not a substitute for hand washing. Gloves, people can wear gloves, but they also need to wash their hands when they take them off and before they put them on.
In terms of getting information out, if there is another case that's been reported in the state, will we be able to talk to you guys at a local level, or is that something that the information would come from a state agency?
The state agency will be responsible for reporting cases in the state. The local jurisdiction will be responsible for reporting the local cases like Davidson County and Knox County, the other counties that, any other county that, so in Tennessee, there are 6 independent health departments or independent jurisdictions. We're one of them. Then the other 89 counties that have health departments fall under the State Department of Health. So they do most of their communications at the state level.
What are the recommendations for the tourism industry, when you come in contact with a lot of tourists?
So the current recommendations continue to be to have a plan, to look at it, educate your staff about the risk, have a place for people who get sick at your event to go, have plenty of hand sanitizers or hand washing stations available, and to be thoughtful and to pay attention to, if there are cases in your community or not. That kind of changes your plan. But to really have a plan. Right now is the time to really be thinking hard about planning and anticipating potential decisions that you might have to make in the future. Planning is really important, and having a plan helps that go more smoothly.
There are folks around here who are immune compromised or immune suppressed, and they're having difficulty getting hand sanitizer. It's really expensive on Amazon. It's sometimes not available at stores. Do you have a plan in place to help those people get the stuff that they need to keep their homes clean?
Well, okay, so you ask about hand sanitizer.
Yeah, hand sanitizer, soaps.
Okay.
For
Okay.
immune compromised or immune suppressed people with organ transplants,
Mhm.
and so on.
Well-
I have been seeing things where they're having difficulty getting the things they need in order to keep their homes clean, to keep from getting all their things that are just in the environment, because people have run out the supplies. So is there a plan in place for those people?
Unfortunately, the state nor the Knox County Health Department has a supply of cleaning supplies to hand out to the general public. And so we don't have those supplies readily available for folks. I think folks who have immune compromise, certainly if they're severely immune compromised, they're going to end up having to stay at home, not because of COVID-19, but because of other things in the community. So are there other places, there are certainly other resources in the community that might have those supplies. I don't know what they are, but that's something to reach out to information lines to see if certainly those supplies are available in the community.
Now, to begin, do you want to speak a little bit about why we test, what we test, when we test, and so what that infers or doesn't as far as information for the
Sure.
specific patient and treatment, and then
Sure.
of course risk to the rest of the community?
Sure. One of the things about this virus and what's happening is that we are such a global community. People travel a lot. They travel everywhere. They travel to places where there is COVID-19. They travel to places where there's not COVID-19. And so, just because somebody's traveled doesn't necessarily mean that if they have a respiratory illness that they have COVID-19. So we risk stratify those folks, and those folks who are at risk, we do test them, but a certain percentage of those folks are going to be negative, and that doesn't mean that there's any higher risk of disease in the community. So just because we're testing more people, because it's kind of a low bar. You've traveled to certain places, and now you have a respiratory illness or a fever. And then you get tested, so you could certainly have many other things. So the level of testing and the amount of testing we do in the community doesn't really imply that there's more risk in the community or more danger for anybody in the community, or there's going to be more disease in our community. It's really not a predictor of how many cases we might have in Knox County. I anticipate that we will eventually have a case in Knox County. But the number of tests we perform now is no predictor of when that will happen or how many cases we'll have in Knox County in the end. For the general public, knowing how many people we've tested doesn't help them decide what shouldn't be used to decide what they do or don't do, because it really has very little to do with the risk in the community. What people need to be doing now is washing their hands, staying home if they're sick, covering their cough, trying to avoid people who are ill. And I'll put it in one more time. If you hadn't gotten your flu shot, go ahead and get your flu shot.
The number of cases tested is, though, an indicator of national readiness. If you look at other countries, they've tested far more people than we have, and they've responded far faster than we did. Would you speak to that, perhaps?
I believe Knox County Health Department has been ready to respond. We've not turned anyone away who has qualified for testing. The State Department of Health has been as well, stood their lab up quickly and was ready to test when it was needed in this community. And has not, anyone who's qualified for testing has not been turned away.
All right, time for about one more question, guys.
I have one. So you talked about coming up with a plan, right?
Mm-hmm.
So what does that plan need to look like? I'm guessing you need to tailor it for your family. Should it be a question of if there is a case, what do you do, or when there is a case, what should you have at home to help your family?
So there are a lot of great resources for planning and preparedness on the CDC's website and the American Red Cross's website, specifically around COVID-19. If you go to the CDC's website, there's planning for your home and for your household, and it kind of depends on your household and who's there and how many people. What's the situation? What the other thing that I think is important for the community to understand is when we have a case, we will know where that case is. That case will be in isolation. We'll be checking on them daily to make sure they're staying in isolation. We have, and people are being compliant, as I understand it from other jurisdictions who've had cases, that folks are happy to stay home because they really don't want to spread this in their community. So they're staying home. We also know who those high-risk contacts are. The process of contact tracing takes a long time because we have very specific questions of the case and of the people they may have come in contact with to determine risk. So we know where that case is. We know they're in isolation. They're not out running around, going to events, going to church, doing stuff like that. And so we're in very close contact with them. So again, when we do get a case, because I do anticipate we'll have a case, at least one, probably more, in Knox County, those folks will be in isolation until it's safe for them to go back out in the community. And that's based on their symptoms and when their fever stops, or when the period of 14 days is over. Whichever one is longest is how long they'll have to stay home, which is a real challenge. We understand that, but people are willing to do that because they understand it protects our community.
Okay, great. Thank you, everybody.
Thank you.
Thank you.